Hi students, it's Miss Renee here, and this is the video for the summary for lesson number 3, which is on community care. And here I'd like to emphasize that community care and intermediate long-term care are used interchangeably. So if you see this word intermediate long-term care, in short ILTC in the exam, it means the same. It refers to community care, and that is something that you need to know so that you don't get confused. To be aware of the challenges facing the acute care system in Singapore, and acute care system are represented by the hospitals in Singapore, both public and private. And for the public hospitals, we have bed crunch issues. So, not enough beds in the public hospitals, and some patients have to be at the corridor and waiting for many hours before they can be admitted. And largely due to the aging population in Singapore. And precisely because of this, and therefore we have to actively move patients to the community care, and sometimes known as the ILTC, which is intermediate long-term care, right? So also, sometimes people do refer that when patients are being discharged from the hospitals to the community care, it also can be called as a step-down care, right? And in the community care or ILTC, these are the institutions that you can see, such as hospice, rehab center, dementia care center, community hospitals, nursing home, and etc. So for this lesson, it's very crucial that you are able to differentiate all these type of different services under the community care. Dimensions of the community care services, there are 3. One is the home-based. So when it's home-based, the services is provided at the convenience of the patients, which is at the patient's home. And for center-based, it is at a center, day rehab center or dementia care center, whereby patients go to these centers in the morning and go home in the late afternoon. And for residential-based, patients do not go home. In other words, patients stay at a community hospital for up to 6 weeks. And for nursing home, patients stay there for up to 4 to 7 years, right? So these are the key difference between a home-based, center-based, and residential-based. And the x-axis here, right, which says the medical and non-medical. So community hospital would have a higher medical need. So usually there is a doctor in the community hospital and inpatient hospice, right? And for this home care and home hospice, there is a visiting doctor because it's at a patient's home. So depending on the patient's condition, the doctor specializing in palliative care will visit the patient. And for hospice or the inpatient hospice, patient usually stays there for up to 1 to 6 months. And for community hospitals, patient stays there from 2 to 7 weeks. For nursing home, patient stays there from 4 to 7 years. So the duration for patient stay in the nursing home, it's the longest, as you can see here, right? And in nursing home, there is medical services as required as well, but perhaps not as extensive as in a community hospital. So the doctor is not based at a particular nursing home, but rather the doctor visit the patients in the nursing home, perhaps 3 times a week. And for the group activity, right, most of the groups did not even specify the issues or challenges in the nursing home sector. So without specifying the issues, which is the crux of the problem, then how can you really recommend the suggestions of improving the conditions in the nursing home, right? So it's important to understand a question and then spend time in answering it. And this is the same skill that's required for the exam as well. Now, for this group activity, right, there are some common mistakes that are made. Some students are confused between nursing home and home care, or nursing home or home nursing. So it is not the same, right? Because home nursing means that the services helping the patients to do the activities of daily living, such as bathing, dressing, eating, right? It's done at the patient's home, that is home help, or home nursing, whereas the group activity is asking for the issues and strategies coping in the nursing home. So this nursing home is an institution whereby patients stays there, patients do not go home, and patients stays there for up to from 4 to 7 years before patients say goodbye. Right? And well, when patients say goodbye, usually the patients will be transferred from a nursing home to the palliative care provider, such as the hospice. So from nursing home to a hospice, right? And hospice providing palliative care, so patients usually stay there for about 1 month to up to 6 months before the patients go to the heaven, right? So you need to recognize the differences between nursing home, home nursing, and palliative care. And with that, you should be able to demonstrate a pretty sound understanding of this week's lesson. I'm sure you're aware that from the 6P of the slides that's given to you in preparation for this e-learning lesson, you can find out about the issues and challenges in this particular slide, which is slide 26, and you can also get the answer for the strategies in managing the issues and challenges in slide 27. So the main challenge that you have for this group activity is really to relate all these points such that it can form a mind map that can be understood easily, and that is the key. So if you give me your answers which is still in the same format like in these slides, then you're not really answering the question. So I would like to remind you to read the question properly before jumping in to answer it. This is a very important skill that you need to learn so that you can do well in your exam. Like I mentioned many times that 70% of the grade comes from your exam. 30% is from your CAG. Alright? And if you have any questions, any feedback for the videos that I have produced, I really welcome them so that I can improve your learning experience. Alright, with that, I'll see you next week. Thank you.